The story of hormone replacement therapy, HRT, is a powerful and sobering example of how profit-driven motives can lead to the widespread use of a medical intervention long before its risks are fully understood. In the late 20th century, HRT was aggressively marketed as a near-universal solution for aging women, promising not just relief from menopausal symptoms like hot flashes and mood swings, but also long-term protection against osteoporosis, heart disease, cognitive decline, and even the effects of aging itself. It was medicine wrapped in glamour, sold with the seductive implication that modern science could preserve youth and femininity through a daily pill. And it worked, at least from a business perspective. By the 1990s, hormone therapy had become one of the most widely prescribed treatments in the United States. Drugs like Premarin and Prempro, manufactured by companies like Wyeth, now part of Pfizer, were prescribed to millions of women. The profits were enormous, with annual sales peaking at well over $2 billion. Physicians, many of whom were influenced by industry-sponsored medical education, prescribed HRT routinely, even to women without significant menopausal symptoms. The idea that menopause was a disease, not a natural transition, became deeply embedded in medical practice and public belief. But the reassuring image began to unravel in 2002 with the publication of the Women's Health Initiative, WHI, one of the largest and most comprehensive randomized clinical trials ever conducted on HRT. The results were startling and damaging. Combined estrogen-progestin therapy was found to increase the risk of breast cancer, stroke, blood clots, and cardiovascular events. The trial was halted early due to the seriousness of these findings. Millions of women had been told that HRT would protect their hearts, only to discover that it might actually be endangering them. The fallout was swift. Prescriptions plummeted, and so did the incidence of breast cancer in women over 50 in the years following, suggesting a link between HRT use and cancer development that had gone unrecognized for far too long. Confidence in the pharmaceutical companies that promoted HRT eroded. Yet the damage had already been done. For years, women had taken these hormones under the impression that they were not only safe, but beneficial, thanks to a deeply flawed body of evidence that was, in many cases, shaped or amplified by pharmaceutical interests. Critically, earlier studies that had suggested HRT's benefits were largely observational and subject to bias. These studies often compared HRT users, typically more affluent, health-conscious women, with non-users, leading to a skewed picture of safety and efficacy. The industry capitalized on these early findings, selectively highlighting them while downplaying emerging concerns. As a result, a medical intervention meant to relieve short-term menopausal discomfort was transformed into a long-term lifestyle drug, marketed as a way to stay young, stay vital, and stay female. Even now, the legacy of HRT is complicated. Today, HRT is prescribed more cautiously and selectively, often with short-term use in mind for women experiencing severe menopausal symptoms. And in some cases, when used appropriately, it can offer meaningful relief with a manageable risk profile. But the broader lesson remains. When drug marketing overshadows balanced risk communication, public health suffers. The HRT debacle is not just a medical misstep, it's a reflection of how vulnerable healthcare can be to the seductive logic of profit. It shows how deeply the pharmaceutical industry can shape not only doctor behavior and treatment standards, but cultural narratives about the body and aging. Menopause, once understood as a natural life phase, was redefined as a medical deficiency, one that required correction with a branded product. Ultimately, the story of HRT is not just about a single drug. It's about the danger of premature mass adoption, the hazards of science distorted by commerce, and the human cost of a system in which risk is often recognized only after profit has already been secured. For millions of women, the realization came too late.